to be. So earlier this year, January, February, when we were all sort of in the throes of the large changes to the US government and the implications for funding, the core team from the MHPSS Collaborative had this really fun idea. How do we pull together all of these voices? How do we pull together all of these perspectives, but yet do it in a really rigorous way, and also try to center voices globally, right? We don't want this just to be a Eurocentric, a US-centric way. How do we do that? They thankfully reached out to me, and I was happy to get involved and excited to do so. So what came next, for some of you who may have seen, was we put out a call, we put together an editorial committee, and then of the contributions that we got, and we specifically were focusing on different components, we were focusing on storytelling, on contributions such as creative contributions, on researchers, from practitioners, from individuals with lived experiences. We were also really interested in getting contributions from all over the globe, and the global majority. And so through that process, we had a very integrated, rigorous, we basically set up a journal just for fun, and had a peer review process, and then invited the very best that we thought spoke to the need, the positioning, and were unique contributions, worked with those collaborators over the summer to see the unique collaborations that we have and contributions we have. So, enough from me. I'm going to show you a video that we hope works with sound, and then we'll transition to a panel.
Young people around the world are experiencing more mental and physical health conditions.
I was diagnosed with type 1 diabetes when I was only 7 years of age. Hypothyroidism at 8. Epilepsy struck me like a lightning bolt when I was 15 years of age. And I also underwent a failed brain neurosurgery. For me, living with NCDs isn't just some abstract concept or a health term. In fact, they shaped my whole childhood, my education, my identity, how I live my life. While other children of my age were learning to play, I was learning how to manage all the syringes as well as those seizures and the stigma, the discrimination from the society. Over time, I realized that these conditions are not just about the body. In fact, they also have a toll on our mental health.
Research shows us that early life stressors, especially those involving family functioning and dynamics, have large impacts on our health across the lifespan. These impacts include mental health conditions like depression and anxiety, as well as physical health conditions like hypertension, diabetes, and heart disease.
Through my research and design work, I've seen how often children and adolescents living with health challenges don't get enough support for their emotional well-being.
I've also seen the stigma that surrounds it in both professional and personal settings.
Non-communicable diseases and mental health challenges are closely linked in Papua New Guinea, especially for children and young people. Many families face stigma and limited services, which inspired me to focus on integrating mental health support into healthcare systems in my country.
Mental and physical health are a two-way street, and the way that young brains develop in response to early life stress can influence the risk of many health conditions later on. Family dysfunction can cause toxic stress for a child while their brains are in this crucial developmental phase, and it can impact their stress response when they're older as a result. Unfortunately, parents globally do not receive enough support to meet the many social and financial pressures that they may face.
I think it is important that we step forward to break the stereotype and support such patients and their families.
This gap motivated me to think creatively about new solutions like using virtual reality to make therapy more engaging and accessible.
We have created a set of evidence-based recommendations for actions at multiple levels to support parenting in the interest of building healthy societies.
My hope is that readers see that with creativity and exploration, there are many ways to approach mental health care for young people. Celeste is one example of how we can combine technology, culture, and play to support resilience and hope.
I really hope that with this compendium, marginalized voices are highlighted, such as those of patient and caregiver perspectives. These are often overlooked in the bigger scheme of things, but are crucial in advancement of research, policies, and practices to improve the quality of life for patients with non-communicable diseases and their families.
I hope this compendium helps others see mental health as essential to overall well-being and inspires actions to create safe, accessible space for families.
I'd like people to walk away inspired to think outside the box in addressing mental health for children and adolescents and people all around the world.
There is no better investment in our future than in our children and those who care for them.
Many of the contributors who weren't able to come in person are also online, so I hope you were able to hear that talk. So we really wanted to try to find a way to share, to share as much as possible their voices. Okay, so now I'm going to pivot to some folks who are here in person and then hopefully one online, where we can talk a little bit more about their contributions to the actual compendium. So, let me zoom this. Yeah, why don't you?
And Naumika, who's online, could you try to unmute yourself and say hello so we know if we can hear you? And in the meantime, we'll ask Isaac to come, as well as Nataya. Thank you.
There she is.
Yes. Can you say something, Naumika, so we can see if we can hear you? Are you able to unmute yourself?
You're unmuted if you just talk.
Yeah, if you just say something, and then we'll see if we can hear you. It looks like you're unmuted, Naumika. Can you say hello?
As we're working on that, why don't I start by introducing our panelists, and then we will have an opportunity to ask them some questions, and then have a little opportunity hopefully for you all to ask some questions as well. Okay, so first I want to start with an introduction. I'll go in order for Dr. Isaac Olufadewa. Okay, I said if I mispronounce it, he could mispronounce my name 10 times. So we're doing the best we can, all right? And so Dr. Isaac is an implementation scientist who leverages digital and social innovation for adolescent mental health. As the executive director of Slum and Rural Health Initiative, he leads the Brave Heart Mental Health Program, which leverages task shifting, digital technology, and policy advocacy to prevent mental health disorders in young people. Working with community members, school teachers, and government stakeholders in Nigeria and Sierra Leone. He is a US CDC HIR modeling fellow and part of the WHO Chemical Working Group, and a widely published social and behavioral researcher who believes in a systems-thinking approach to promoting mental health. So welcome, Dr. Isaac. I'm going to do everybody's intro and then I'll pass it over to you. Yeah, it's just two of you in person. And so then next, I'm going to pass over to Nataya, Branjerporn, I'm doing terribly, I'm so sorry. And she is a manager of programs and partnerships in Oregon Global with over 8 years of experience in youth mental health. She leads Oregon's efforts to elevate youth mental health practice and strengthen promotion and prevention initiatives, including the Being Initiative. Nataya co-founded Oregon's Youth Mental Health Fellowship, an online education and mentoring program for youth advocates worldwide. She represents Oregon on the WHO Youth Council and was previously co-chair of the Global Mental Health Action Network's Child and Youth Working Group. An occupational therapist by training, she completed her PhD on peer-based approaches to supporting maternal infant mental health in South Asia. So thank you so much and welcome. And then finally, we have our third contributor online, Naumika Khanna, is a student of clinical counseling and child psychology with lived experience of type 1 diabetes, epilepsy, and a failed neurosurgery. You saw one of her contributions in the video just now. Speaking from India, she represents millions living with non-communicable diseases, epilepsy, diabetes, and mental health conditions. At the UN General Assembly High Meeting, here she is sharing her voice, not only as a panelist, but as a co-creator, urging action for dignity, equity, and inclusion. And what makes this moment especially meaningful is the commitment to inclusivity, validating lived experiences and ensuring diverse youth voices shape a more compassionate and resilient future, something I think we can all share. So let's start with our in-person votes, and we're going to do an opening question for everyone. Do you both have mics? Yes, fabulous, great. So I'm going to start by asking you if you could share with us what is the single most important reality on the ground, or what do you think policymakers often miss when they're designing these integrated NCD and mental health programs? Maybe we'll start with you, Dr. Isaac first.
So thank you very much. Basically, I could really start with the story of the Brave Hearts mental health project that we are doing, which is a mental health project where we work with young migrants in IDP camps, migrant camps. We call it like internally displaced persons camps in northern Nigeria. And basically, when you go to those communities, one of the key things that you would find is that mental health is not their most important challenge. And many government policymakers, when they really go to those kind of communities, they just really focus on we have to address water, we have to address housing. While all that is important, they have an underlying mental health challenge, and these issues are not being brought up because if you give them a questionnaire, like researchers will do, or if you tell them, if you have a focus group discussion with them, they will most likely not tell you this. And as young people in Slum and Rural Health Initiative, so one thing we did was we went to those communities and then we basically started playing football, board games with the young people. We started interacting with them at a much more personal level. And eventually we discovered that their challenges were much more than the usual. They need housing, they need water. They also had mental health challenges. And there was a huge stigma. People weren't talking about this. And what we did was, after talking with the community members, the community leaders, the youth leaders, the women leaders, basically sometimes, separating them, sometimes talking with them, all together, we definitely agreed that there was a mental health challenge. And then we basically looked funding, working with an integrated innovation solution. And I think when government stakeholders go to these communities, one of the things that they look for is, how can they start coming to distant tertiary hospitals, which sometimes is very hard for them. They don't have the transportation cost. The stigma of them going to these communities and to these health facilities can be very hard for some of them, especially when or if you don't work with the systems or a community-based approach. So we basically brought the hospital to the community, and then that's where we created the friendship tent. So the friendship tent was made of reusable cargo container, not new one. reusable one. We basically cut the window in there, put solar power panels on that. Brought it, and then brought in the system where community members could communicate on these issues. And we set up a triage, like a referral network where really very difficult cases or like severe cases could be referred. But that alone, taking that tertiary system and taking it to the community health system is one of the very important message for policymakers. We do not just have to solve the mental health challenges. What we did, we also provided like skills training for them. I got a grant from Women for Young Leader program, got a vocational skills training for the women in the communities. As the women were having their vocational training, the young people were learning coding, digital literacy skills. So it doesn't come in as this is Dr. Isaac, we want to have a mental health program in your community. What's mental health? There's a very big pushback there. But solving this scientifically, we have the group-based psychotherapy sessions that we have, cognitive behavioral therapy sessions that we give to them. We also have the digital skills learning sessions that we give to them. We have the peer, the sport, and the play-based system. So, and we didn't have money, when we went to the community where young people, we had the opportunity of getting branch of this Canada being initiative that have really helped our work on the ground. And we're shifting now from even a treatment perspective to a more prevention-focused lens, because when we train the community members to perform this cognitive behavioral therapy, we saw in their local languages, they do so in their local languages because we got bilingual experts who train them, make them understand the systems in a very easy to understand system. We have seen a very huge difference. So shifting from that tertiary or secondary healthcare system to a community health integrated innovation system is something that we've always pushed while we work with the government stakeholders. Thank you.
Great, thank you so much, Dr. Isaac. Nataya, do you want to go and say what do you think people are missing?
Thanks, Sabrina. And I wanted to start off today as well by acknowledging our partners, Sense International India, Khanna, who also were co-authors as well on our article. I think as we consider some of this question around what's the reality on the ground, I think it sets the scene for this week that we have this political commitment and we have the vision through the declaration this week, and that this is a key agenda item, but how do we translate that to action? That no longer needs to be a question. How do we do that? When do we start? How can we go about this? But rather, communities themselves have answers to that question. And in the work that Origin has done around policy led across sectors, there were three recommendations. First, to develop youth care support for chronic conditions embedded within health systems, to increase integration across physical health and mental health, and third, to develop cross-disciplinary connections. So rather not how or when, but let's do it. Let's do it together and help you start a journey around action.
Great, thank you so much. Now we'd like to turn to you, Naumika, can you go? Yes.
Yes, absolutely. So first of all, am I audible?
Yes, you are. Can you perfectly?
Wonderful. First of all, it's a very powerful question that I would like to answer with the huge amount of detail, taking my country into context. First, the thing is that, the reality that policymakers often miss when designing such integrated NCD and mental health programs is that though the policies look neat on paper, lived experiences are quite lived in complexity. So integration and inclusivity, like a lot of your leaders earlier talked about, is not about just one size that fits all the solution. Rather, it must be rooted in cultural humility, community voices, and lived experience. And I would also like to quote a very famous quote by Viktor Frankl, which said that an abnormal reaction to an abnormal situation is normal behavior. So when we design programs without listening to people or excluding the people who live with these conditions, we often mistake their survival strategies for resistance and stigma for ignorance. And I would like to give some frontline examples, such as a woman may decline insulin not because she does not care for her health, but because of the fear of being labeled weak is greater than the fear of more complications. A young man with epilepsy may avoid going to clinic not out of the denial that he does not have epilepsy, but because every visit may reopen the wound of the stigma that the society today has attached to his seizures. And I must, with deep fear, as everybody is sharing about their countries, raise a reality from my own country, India. So, intractable epilepsy still remains outside the Rights of Persons with Disability Act in India, right? And since India is a proud signatory to the UNCRDP, and yet conditions like epilepsy are legally invisible, especially if we take into context the rural strata of the society, like we were all talking about. And in India, people have to travel hours from rural areas to reach to urban areas to just have an OPD visit. If other nations are moving towards expanding the protections, then why not India? Again, this is not a criticism. Rather, it is an invitation to introspect for all the policymakers and all the leaders that are present here today. And as Rumi, many of us knows his quotes, but that is a one very famous quote that I would like to quote again, that it is the wound which is the place where the light enters you. And when these certain conditions are excluded, the policy deepens wounds instead of allowing the light to enter. So I believe that this compendium that we are discussing today is powerful precisely because it honors what the policymakers often overlook: the wisdom of the frontline, the stories of resilience, the call for equity, which is the need of the hour, and I believe so, is more than what we believe important than equality, because individual differences matter, especially in the field of mental health, from where we all originate. It reminds us to listen that before we design any law, or before we co-create, before we implement and adapt any law or any scale, then only the integration would become more than a slogan for people with lived experiences. It will become a lived experience for people with lived reality of NCDs, navigating not only just NCDs, but mental health, as well as the caregiver burden, which is talked about, which is honestly invisible part of the society. The caregivers, though they may smile a lot, but they also carry the burden of their children every single day. And as Sir rightly said in the video, that it could also result in the dysfunction in the various brain parts if these issues are not addressed. And as many of us just noted, that it is very important for caregiver burden to be acknowledged on the lines of the society. That is what I have to say, and thank you for giving me an opportunity to say my piece.
Thank you. And we're a little late, so we're going to put it a bit, and we're going to jump sort of to the end for my panelists. for just one. I feel like we've had so many stories, so many rich vignettes, data, etc. People here are probably like, okay, what do we do, right? What do we do with all of that energy? So, and we'll go to you, Naumika, first. But if you can think of just one piece of advice for somebody in the audience person in the audience online, one piece of advice, now that you're inspired to build these bridges in your own community, what's one thing they can start tomorrow?
So I believe that my one piece of advice would be very simple. Start by active listening, which is the very core component of any profession that involves mental health. Every community has stories, some treasure which is hidden. Stories of struggle, stories of resilience, stories of hope that often go unheard. As someone passionate about NCDs and chronic illnesses, I've realized that real change begins when we truly understand people's lived experience. Don't just, go for and wait for the permission or perfect conditions to occur. So, for example, if I wait for a perfect condition as an NCD advocate, that if this happens, then I'm going to take this step. No, it is not the right thing. Share what you learn. Exchange ideas that we exchanged today. Connect with others with full pride and use small steps to create awareness, empathy, be congruent in the present, and support. And honestly, I believe that smart goals are very important for the upliftment of the society, but I made smarter goals since right now only since virtual things were discussed. So where S stands for specific, M stands for measurable, A stands for achievable, R stands for relevant to our times, and T stands for time bound. That is what we all know. But what about the ER part? The E stands for which could be evaluated in quantitative terms as well, because statistics is important, and R, which is rewarding intrinsically and altruistic in naturalistic goals as well. So even a single conversation or initiative that you have in your mind can plant the seed for larger change. Remember that one bridge or even large bridges could be built by one step at a time, and your genuine care for the people could be the first plan. And that's it. I'm so grateful for the members of the Compendium to give me and express me and letting me express my views honestly. It's actually, I'm grateful to them for letting me express any kind of view. And that's it. For smarter goals as well. That's what I made. Since that virtual thing was shown, I can't name it right now, but definitely keep it in mind that it's something that's very good and innovative. And so I made, instead of smart goals, smarter goals. That's it. You may ask the other participants as well.
Thank you so much.
Thank
Thank you for joining us. We know it's not a convenient time, so we really appreciate it. Thank you. Dr. Isaac, something to leave us with. What can people do tomorrow?
Okay, I would say we should move from what's your comments and look for what's working. I know as researchers, as innovators, we go to communities and look for what is not working. When we started, we discovered that more than wanted to work with 20 community members to do the past year. We got 60, and then we discovered that willingness. So that's power of looking for what's working is very important, and then combining both social and digital innovation is very key. Make sure that you have a mental health program that speaks the language of people in their own local language. Thank you.
Right. So in terms of advice, I have three things. I think first, how we understand the problem has to make sense to the community and decision makers. So in our case, that looks at doing a cross-sectional population survey. So we knew 11% of Australians had sort of correlational health conditions. And in India, they developed their own method of giving assessment to their environment. Second, think about building broad-based support and advocacy. So international India has very clear advocacy groups around people with blindness, with experience, siblings, and behaviours who are contributing to national advocacy through these networks and receiving peer support. And the third thing is supporting inclusion and intervention, which is what has been spoken about many times today. But for example, that international India providing livelihood support and micro-business support in addition to mental health and activity support, as well as thinking about how we shift the systems that we invest in to enhance integrated primary care, to support enhanced workplace coordination, and how we get out of the silos of our care through the readiness of time for that change across and within that.
Thank you so much. Let's have an applause for our panelists.
So I'm going to reduce my 5 minutes to 2 and just share with you that this is not we haven't an event and that was it. We put together a compendium, we've learned a bit more about the diet and but we have actually developed a model that we call collaborative action model for youth language. And what we want to do with that is to see a way to move from patterns and dialogue to structured factual outputs and the faster. And it's really how we do the different kinds of outputs to the table. So the 4 R's, this resource, choose your application. Are you looking to do any policy or write a policy, or develop an intervention, like an advocacy campaign, or establish a research collaboration, or even to explore an integrated approach that we could do today? You have to take over to the 30 step. And then we'll back to the next step. So there you go, share understanding through problem validation and coalition, consensus building, and mapping of evidence. So the next step will be a work compendium. How we're doing this together and different kinds of perspectives and voices on what the issue is. And then re-envision. So we would move from what are some of the problems. So we first need to kind of narrow it down a bit because this is a very broad area. But if you bring those actors to address the divide in a certain way, we would look at what are then the problems for that particular situation. Say that it is children with diabetes in India. Or it can also be at a higher level at a global level. We move to brainstorming and categorizing different types of solutions and then prioritizing them using agreed criteria and then calculating that. So we develop a agreed action plans with resources, goal division, and pathways to scale. But this whole thing we would go through in a number of online workshops with those actors in this way. So we actually, by the end of this we wanted to invite you all. The outcome of that would be a playbook for action, which is that go ahead and yes, do it. We've heard it a few times now. If we know things that are political support, then what is to be done in different contexts. So with that, slide. We have a QR code here that you can in case you're interested, like expression of interest to look at this device further and potentially be an actor as part of this work, whether it's coming with technical knowledge, or it's coming with resources, or it's coming with a context that has certain issues that need to be addressed. And this compendium that we launched today, it has the website start, and we would like to invite you to engage with collaborators and contributors and champions to move us through the next phases and work towards this playbook for action that can bridge the divide between NCDs and mental health for children and young people using policy and programming for further research and advocacy. And if you want to join this journey, feel free to scan that one. The next scan will also show both the actual compendium and this link again, just so you know it's going to go on in the background. Over to our closing remarks.
know, it's hot, we're almost done. Thank you.
So I think that today was a very powerful program, and I don't feel like we need to add a bunch to that. So let me just underscore a little bit of what I thought was important. I think it's really important and very impressive to see here today the fact that you've been able to gather the World Health Organization and UNICEF and that as the WHO and that kind of organizational body, and that you have attracted. Now I know there's the UN high-level meeting going on at the same time, but it's a big schlep to get from there to here, so it's not exactly, it's a pretty big investment to actually make a trip up to the George Washington Bridge, so congratulations for that. And what I think is really important about that is that I see really enacted here the seriousness of those organizations in helping to create this space for youth, who were the most important speakers here today from my point of view, to be involved in identifying solutions and characterizing problems and imagining, what are the programs. I thought it was very powerful to listen to Dr. Isaac and Albert and the other youth who were here talking to us about their experiences and their voices, and they had something really important to say. And that's not always something that is clear to us in academia. I think it's a hard lesson for us to learn, because we're sort of used to the fact that you have to be a full professor and have been around for 30 years before you're entitled to say anything. And I think that's wrong. And so I think we've seen a real demonstration about that. So congratulations, and congratulations for all your work. And I hope to be able to continue to see you as this work develops and learn from you. Thanks.
So we have some quick acknowledgements from folks who were engaged, and then we have some quick acknowledgements in the room as well. Liz Burma, who has just been amazing, along with other folks who have helped and supported. This wouldn't exist without you.
And I also just want to say thank you so much to Victor Hugo and Louise Yule Hansen, who are my colleagues back home in Denmark, who really came with the first initial idea to put this together, and I was the only one who could travel, so Victor and Louise, thank you so much as well.
So that's it. There's another QR code here. There's other things you can take. Please take some food, take some small sodas or bananas, whatever you want. And thank you so much for coming. We look forward to continuing the collaboration together.